Okay, go ahead.
Yes, I asked you in the course about vitamin D deficiencies and problems receiving vaccinations. It seems if you have an immune defense system, you take more problems from vaccines than otherwise. But I don't know if you made any thoughts on that question.
Nothing specific, although in general, people who are immune deficient tend to not respond to the vaccine. So people, who are malnourished, or people who are, on immunosuppressing drugs, tend to not have the desired immune response to a vaccine, and they also don't have the desired immune response to a disease. And we know that low vitamin D levels correlate to disease. When people come into hospitals with cancers and autoimmune diseases, usually their vitamin D levels are below normal.
If you have chemotherapy and cell transplantation, is there any vaccine you would feel that you need?
Well, I wouldn't have chemotherapy, so that would be the first problem that I have. And if I did have chemotherapy, I wouldn't have a vaccine. But that's just me, and that's why I suggest that people understand the risk of disease, how the disease can come into your body, the risk of the vaccine, the potential effectiveness or non-effectiveness of the vaccine, and any other way that we can deal with the disease besides the vaccine, and then you make your decision. She asked about, she said Dr. Russell Blaylock talks about population control as being one of the reasons for vaccination. And I stay away from the politics because I study the science. And what I can tell you scientifically is that there is a doctor in Australia, I can tell you her name in a minute if you want, but she has actually written and lectured on the fact that the Gardasil HPV vaccine is causing sterility, actually it's not sterility so much as premature ovarian failure in young girls. I can look, if you give me a minute, I can answer that. The other thing is that in my tetanus presentation, I actually have several slides that I prepared but didn't show you it's basically, this is actual medical journal research showing that if they included human chorionic gonadotropin in the tetanus vaccines, that they act as birth control. Now, it was supposedly a reversible effect, but it has been done throughout the world where women are giving more than one dose of vaccine that contains both the tetanus toxoid and the beta HCG. So I can tell you that there have been instances of events where sterility was actually the goal, and I can tell you where it was supposedly not the goal, like in the HPV vaccines, where some of these girls are basically becoming menopausal at the age of 13. Now, I would say, listen to Russell Blaylock and you make your own conclusion, because what I do is I talk about the science, which not only is not there to support the necessity of vaccination, it's not there to support the safety of vaccination, and we don't have any long-term studies looking at sterility rates between the totally vaccinated children and the not vaccinated children.
What's your opinion on vitamin K that's being administered to newborns?
My opinion is that the more I read about vitamin K, the more I can't believe that it's injected into newborn infants, and that if you look at my scientific endeavors have really shown me that by and large, nature overall didn't make mistakes like this. Nature didn't leave out vitamin K from babies. And that until babies are 6 months old, they're not actually having a full coagulation, normal coagulation. So there's a reason, just like babies are programmed to be anti-inflammatory, I believe that babies are programmed to not have numerously higher levels of coagulation than adults. Also, if you look at the coagulation supposed deficits that a baby has, it's not just the vitamin K factors. So I would suggest that you read a lot about it and consider if you feel better about giving it, then only give the drops. But most people I know who understand the difference don't give any at all. And if you do give it, maybe it would just be if there was an extremely traumatic birth. But you have to understand some of the things that medical interventions do at birth. For instance, when the baby is born, what happens is it's a very tight passageway, as we all know. And so the baby is squeezed very tightly. The cranium is made so that it can compact in on itself. The brain is squeezed. There's trauma all throughout the body. About 30% of babies will have microhemorrhages from a normal delivery. Now, afterwards, in most societies, that cord is clamped right away, which is a problem, because you're not only leaving behind up to 40% of that baby's blood that belongs to that baby, but you're also leaving behind stem cells, which have the potential to go in and clear up any of the problems that happened in the brain or elsewhere. Now, if you thicken the blood, what is it, 2,000 times more or something like that, then how is that going to affect the ability for those stem cells to go where they need to go? When you have these vitamin K factors, those areas that bleed tend to clot, and it's a little harder to clear that out than if you just leave it that way. The concern is always the minority, this vastly small percentage of children who can develop an intracranial hemorrhage, and it can be problematic. So we're now treating everybody for this problem. So I think it's important to understand the full spectrum before agreeing to the injection, and it should be your personal decision that you feel comfortable with after knowing what there is to be known about vitamin K, which I believe in the USA has been given since the 1970s, something like that, but before that we weren't giving it. The other thing is that if the baby's clotting is not full until 6 months of age, how long is your injection going to work for? So it's not completely logical that giving a huge injection on the first day of life is going to protect them over the long term. But I think that it's always a good idea for mothers to consume lots of greens during the entire pregnancy if possible, because not only do you get vitamin K that can be delivered to the baby in normal amounts if they need it, but you're also getting folic acid and magnesium and lots of other minerals that are required to build a baby.
I have a question about last week in Sweden, women from like 17 to 24, they get a letter that tells you to take the cervix shot for cervix cancer. Do you have anything about it?
The shot for cervix cancer, well, how much time do we have?
Please go through that. Please.
All right. I'll do a little bit on HPV. I'm not going to go through every one that I have, but I'll go through a few of them. As you know, there are these, cute little ads that are shown to teenage girls that, you're hip and you're cool and you're doing the right thing if not only are you having sex, but you're getting a vaccine to prevent you from getting cancer for having sex. And girls are promised, in USA, iPhone, raffle tickets and things like that if they get their vaccine. So these are just some of the ads that are being used. Some of them are much worse than this. The biggest problem with calling HPV vaccine an anti-cancer vaccine is that they haven't studied it long enough to say it's an anti-cancer vaccine, but that most of these infections will resolve spontaneously within 1 to 2 years. and that these are slow-growing cancers. They're caught, the vast majority are caught doing just cervical pap smears. In addition to that, there are ways to reverse this, what we call atypia or dysplasia, that can be associated with the HPV. And I'll talk about that in a minute. This slide is basically just showing you that 99.85% of humans who are exposed to the 16 and 18 serotype, the supposedly high-risk viruses that are associated with cancer after multiple prolonged infections, will actually never develop cervical cancer. Okay, so this is actually from an official World Health Organization sponsored by GlaxoSmithKline. You can see up at the top. So can't really argue with that. HPV isn't just sexually transmitted. Some babies are born with it. Some babies pass it to their parents. Some parents pass it to their babies. There are lots of other animals that have it. It's found on skin and throat and from tonsils in children. So about 11% of people have some form of this without having had any sexual contact at all. And so to think that we can give this vaccine to 9 to 12-year-olds because they're virgins and that it will be helpful is not necessarily rational, especially given that there's scientific evidence that if you already have these strains of HPV and then you get vaccinated, that your risk is higher for abnormal cell development. This is a good one for you to know about. In 2008, Gonzalez Bosque, I probably butchered that name, published an interesting paper where they actually looked at the cervix of women who had developed this carcinoma in situ, which is what you're worried about because it can turn into invasive cancer. This is non-invasive cancer. And they looked to see what strains of HPV were in these particular abnormal cells. And they found that, that there were other types that were not 16 or 18. They found that some of them had no detectable HPV at all, but more importantly, that only 28.2% of women who had this abnormal cervix development confirmed by actual biopsy, so this is not philosophy anymore, this is actual biopsy biology, were exclusively infected by 16 or 18. And they said that this places doubt about the degree of protection afforded by this vaccine. So different countries, different populations tend to have different strains that are more prevalent there. But 16 and 18, there's two other ones that are in this vaccine that are not associated with so much the cervical cancer, but 16 and 18 are the ones that are supposed to be preventing cervical cancer, and they're not present in they're only present in 28.2% of these biopsies that they did. I'm going to skip that one. I already talked about this, that if HPV is already in the body, we know that 11% of the population is already exposed regardless of sexual activity, and this is a conservative estimate. And this paper, Gardasil Clinical Review, June 8, 2006, showed that Gardasil vaccinated people who had these pre-existing infections had an increased risk of precancerous lesions of 44.6%. There's other study that shows with Cervarix, which is the vaccine I think you're using here, and that's around 30%. I actually have these papers that say this. Okay, so if we compare in the developed world the prevention rate between pap smears and the theoretical prevention rate from the vaccine, what we see is that pap smears are a much more efficient and useful tool to prevent cervical cancer. This pap smear data is actual data because.
Can you just tell us what pap smear?
Oh, it's.
Cellprov.
Say it louder.
Cellprov.
Okay, thank you. Is that this is actual data because pap smears have been done for like 60 years or something like that. So we actually know the incidence rate in societies that are getting pap smears. So it's around 8 per 100,000 women. And remember, this is a slow-growing cancer that the vast majority are able to be treated and their lives saved. For the vaccine alone, this is a theoretical number that 14 out of 100,000 would be the rate of cancer for Gardasil and 9.5 for Cervarix. So you can see that compared to both of these, pap smears are still a better bet. And you're not being injected with caterpillar, DNA, and aluminium. So speaking of caterpillars, I had to take a couple pictures for you. This is the insect cabbage looper that is used to propagate the virus. As I told you before, you have to grow virus on a cell in order to be able to harvest the pieces of the virus. They also use one of the adjuvants in there is called ASO4, monophosphoryl lipid A. This comes from a salmonella bacteria, from the outer coat of the salmonella bacteria. And it also contains polysorbate 80, which some have theorized this to be a potential infertility agent. One of the problems with vaccination studies, it's a big problem, is that they don't use real placebos. Okay, so for instance, it's very rare to see an influenza vaccine trial where they used a saltwater injection as the placebo, which is what should be the placebo. What they do instead for influenza vaccines is they either use the previous year's vaccine or they use hepatitis A vaccine. And when you ask why, they say, because we don't want to deprive half of these study participants of something that could benefit them. I kid you not, that is the official answer. So it's not different when it comes to cervical cancer vaccine studies because they have been using placebo, which is called carrier solution. So as you can imagine, the adverse event rate will be altered by using a substance that will have an effect, especially a substance that can have a negative effect. And this is just showing you that placebo includes aluminium and saline. They did both. The background substance, let me see what this is. Okay, this is the product formulation. This one, I believe, is for Gardasil. So it has the 4 different HPV proteins, has 225 micrograms of aluminium, L-histidine, an amino acid, the solvent, detergent polysorbate 80, sodium borate. So this would also be considered as carrier solution. And I looked each of these up and they're not inert. I mean, the sodium chloride, you can say, might be depending upon what the concentration, but the concentration of sodium chloride can make it either compatible with the body or not compatible with the body. Okay. There have been deaths that have been reported to be associated temporarily with HPV vaccines. One of them happened to have happened in New Zealand, and the girl's autopsy was done by the local coroner, and he said there was nothing wrong with her, everything was perfectly normal and was ready to be done with it. But the parents fought to be able to get some of the specimens sent off to experts in Canada and United States for them to look and see with more sophisticated techniques if there were any elements of the vaccine found in these tissues. And what Dr. Lee, who is one of the prominent scientists doing this, found in the spleen and in the blood of this girl was recombinant DNA HPV fragments that were bound to the aluminium. And she died 6 months after her third vaccine. So you can see that even at this point, they're finding in her body fragments and aluminium. And I told you earlier that the way that this HPV, these particles of HPV, the 16L1, are bound to aluminium is they use a special technique that is unlike any technique that's ever been done in vaccine manufacture. So you can go and read that case report for yourself. Undegraded viral DNA is known to activate the immune system, both in the brain and the body. So we can say here that this is undegraded viral DNA. The brain specimens were looked at by Tomlanovic and Shaw in 2012, and they reported that these vaccines containing this HPV, this is the particle 16, pose an inherent risk for triggering potentially fatal autoimmune vasculopathies. Those are blood vessel inflammation disorders. This is more from Tomlanovic and Shaw. She says, our analysis showed evidence of an autoimmune vasculitis potentially triggered by the cross-reactive HPV-16 antibodies. Remember earlier when I told you how microbes have this similarity between us, and that if we react to microbes, we can react to ourselves. Well, here's an example. So these antibodies bound to the wall of cerebral blood vessels in all examined brain samples. We also detected the presence of these HPV-16 particles within the cerebral vasculature, with some HPV-16L1 particles adhering to the blood vessel walls. This pattern, in the absence of an active brain infection, indicates an abnormal triggering of the immune response in which the immune attack is directed towards self-tissue. This is a graph that shows you a comparison between HPV vaccine adverse event reports, those are the ones in purple, and then the blue ones are all other vaccines combined. So these are the reports from our vaccine adverse event reporting system as of August 2013. It's between June 2006 to August 2013. And you can see that there is an enormous disproportion of adverse events related to this one vaccine compared to all other vaccines combined, and that oftentimes it far exceeded all other vaccines combined, and that if everything was proportional, because these are only 7% of the vaccines that have been administered, these purple bars should only be down here. So they're much higher than what would be predicted. We can see here, this is the death right here. This is deaths from all other vaccines. This is deaths reported from HPV vaccines. Serious reactions are here. Look at that comparison. Total events, almost 3/4 accounted for by HPV vaccines. Spontaneous abortions, sexually transmitted diseases, look at that. Now, part of this might be because these girls think that once they get these vaccines, they can just go partying as much as they want to. And that's one of the problems, because it's a false idea. Life-threatening reactions right here. Hospitalized. So you can see it's a problem. And let me tell you that this won't make a difference in the proportion, but that the fact of the matter is, and it's publicly known, and even pro-vaccine people admit, that only 1 to 10% of all adverse vaccine reactions ever gets reported. I can tell you that when I saw adverse reactions happening in the hospital, it was very difficult for me to get another doctor to report it. And you don't even have to be a doctor to report. You can be a family member, a nurse, a technician, doesn't matter who you are. Anybody can do these reports. This is just another way of listing out the up-to-date reports for Gardasil, 990, and it's more than that now because this was put together 2 years ago. Abnormal pap smears, look at that. 549, cervical dysplasia, cervical cancer. I've seen personally known women who have developed serious genital warts after the vaccine. So what do we do? Besides having pap smears, which we already know is a more effective way to detect these cancers, there are actually ways to reverse them, and there are actually ways to prevent them. And we know this, it's well established. You asked about vitamin D earlier, and we know that vitamin D is a necessary requirement for normal cell-mediated immune function. Obviously, barrier method of sex and limiting number of partners are known to decrease the HPV passage. Smoking is known to be a correlate of cervical cancer. If somebody has full-blown AIDS and they get infected with HPV, it can be a disaster because their cell-mediated immune system is not functioning properly. But if we have a normal immune system that can function properly, we know that there are lots of nutrients that support that. Selenium is known not only to support the immune system, but it's so interesting that there was this study down in, I believe it was Cuba, in the 1990s, where they showed that there's a certain virus called Coxsackie virus. And in people who are deficient in selenium, the virus actually mutates in them and can become more problematic to the person that becomes infected with it. That means that poor nutrition is a detriment to herd immunity. So if somebody wants to tell you you not vaccinating is being irresponsible, you can tell them that them not eating well is also irresponsible. So we know that vitamin C ascorbate is necessary requirement for the immune system. Beta carotene, vitamin A, iodine, foods that have iodine, folic acid, all of these things. I've got journal medical articles that show that this is helpful antioxidants when it comes to viral infections. We live in an era today, where more people are immunosuppressed by the medical system than ever in history. So the medical system is actually in part responsible for the susceptibility to these infections. Steroids, chemotherapy, a lot of the arthritis drugs are immunosuppressing, as well as taking drugs, staying up all night, and all kinds of things like that. These are other choices we can make. Was this something related to the slide that you have a question? Because if not, let me just finish.
Were you surprised that the immunosuppressing circumstances that they only make you sicker? I mean that there's a connection there. I don't know where I was going with this. I was thinking about something. Let me get back to that.
That was so honest of you.
Yeah.
I kind of saw where you were going, but then I lost it with you.
Yeah, me too. That happens.
But I will tell you that there have been people who have had immunity to tetanus and then underwent chemotherapy and lost their immunity and developed tetanus as a result of losing their immunity. And that was because of chemotherapy. I want you all, if you have a cell phone that takes pictures, to take a photo of this. I remember earlier I said to you there was a lady in Australia who was reporting on the premature menopause. There's her name, Deirdre Little. These doctors, Shaw and Tomljanovic, are not only the aluminium scientists, but they also have been looking at this problem with HPV. Dr. Scott Ratner is a cardiologist who's speaking about his daughter's severe vaccine injury. She was a healthy, athletic scholar who was doing fine, and then she got her HPV vaccine and became disabled. And then this organization down here, SaneVax, has numerous personal testimonies and evidence-backed resources, and they're always updating them. So I recommend that you utilize these resources and look them up. Let me just finish this one last slide, because I looked into Finland last year about this, using Finland as the gold standard for effectiveness of PAP testing programs. We see that cervical cancer has declined a measurable 75% over the past 60 years because of PAP smears. So what are we doing here with these vaccines, these HPV vaccines? I leave that for you to answer. All right, you had a question that I didn't answer.
Is it true that you can't sue the vaccine companies in the US?
Can you sue them here?
I don't know. I haven't tried
Oh,
yet. What
Okay.
I heard in the late 60s or in the 50s, there were like 16 companies. They reduced
Yeah.
to only 4.
yeah. What happened was in USA, there were so many lawsuits before the 1980s against the vaccine companies that they were starting to fold. They were going bankrupt. And so the government stepped in and said, okay, what we will do is we are going to set a table of vaccine injuries. And if your child has an injury that's consistent with our table, we will compensate you. But then what happened was they changed the table. So after they got, the agreement to make this law, they made the table smaller. And so today, there are some outstanding 5,000 families are now with autistic children with no compensation, because not only is the research tainted on autism relating to vaccination, but because the tables that are reimbursed just don't include that unless there are certain very specific circumstances. Now, if you fail to get the result you wanted in this special court that is completely different than any other court, it doesn't have any of the procedures that a regular court has. But you can then take it to the next level, and you can, this is how I understand it, but then you can try to sue the vaccine company after that. But you have to first go through this stepwise process. And it's very disappointing to a lot of families. Not only do they largely not get compensated, but when they do, it's usually not enough. Let me get someone who hasn't asked a question yet.
Yes, I have a question about the immunology and mutations in vaccines. And the whole idea of giving a vaccine is that it should be suitable for the virus that you will get eventually in the future. And as we all know, the process of creating a vaccine is time consumable, and it will run over time. And I find it interesting that, given the fact that the virus is being able to mutate, how can the industry predict how the specific virus is going to mutate in the future?
Okay, that's a really good question. And I have 2 examples I'd like to tell you about. One of them is with influenza vaccine, because as you know, what they do is they go to Asia and they look to see what are the predominant strains of influenza to predict what will happen next year. And then they make a vaccine from those 3 strains. 2 strains of A and 1 strain of B, I believe, is how they do it. The problem with that is that they're often wrong, is that they guess the wrong strain that year. But more importantly is that the strains drift. There's strain drift and strain shift throughout the year. So even if they got it right, the vaccine that you received might not, by 3 months later, after viruses are circulating, everything could be different. So that's one example. But there's another example when it comes to pertussis, whooping cough. And that vaccine the vaccine we have today has several of the antigens from the bacteria. It's not the full bacteria. And what we're finding is that there has been a mutation in the bacteria circulating as a result of the vaccine. And this is well established in conventional publications. I could show you them if you want me to, the authors and everything. But they found that the new mutated bacteria, just like what happens with antibiotics, is they can outsmart the bullet, so to speak. And so they don't have an antigen called pertactin. And you would think that that would actually make it better because it's one of the antigens that helps it stick to you. But the problem is that the immune system, the reaction to that pertactin is part of what makes the immune system more efficient at getting rid of the bacteria. So in essence, what has happened is people who have vaccinated with DTaP have changed the bacteria and made it worse for the herd. People who developed the natural disease or who were not vaccinated are not contributing to this, and it's well established that the vaccine itself contributed to the mutation of this bacteria over time to make it more virulent. It stays in the body longer and it can get deeper into the body as a result of the vaccine. And because 86% of all cases of whooping cough are vaccinated, they know that this vaccine has actually been a partial failure. And there's now new vaccine that is going to be offered that is inhaled. It's a killed whole cell vaccine, and the hopes are that that will be more effective. But the plan is not to stop the injections, it's just to add this to the already program.
If you had small children today, would you take them to another opportunity? Would you take them to the so-called measles party? Would you consider that a responsible thing to do, or?
I can't comment on that because I think that parents need to understand what measles is. They need to understand the optimal age to develop measles. They need to understand the risks depending on who you're exposed to when your kid has measles, and they need to know how to treat it when they have it. So I think it's irresponsible to expose your child to measles if you don't understand all those things. Is there someone from over here? Because I've neglected you all completely. Okay, no. Back there.
I just have a question. If you don't able to breastfeed your child, maybe more than 1 to 3 months, and then you want to give them a good immune system, is there something you can recommend them to eat? I just have one more, I think, to. Du vet vad heter kikhosta? Did you hear? Yes, there have been cases in Sweden now with this disease, and I know that 2 children died of this. And as parents, you want to give the best immune system to your child. Do you have something to?
I'll first say that the children that die of pertussis are taken to the hospital. They are usually, the breast milk stops and formula starts. Antibiotics are given. They're lied on their back. And I think those things contribute to negative outcomes. Secondly is that I have personally treated 2-week-old baby with vitamin C. The baby is now almost 2 years old and thriving and doing well. So I have treated babies from, you can't have pertussis any earlier than 2 weeks because it takes that amount of time. So you cannot, so babies, look, I get emails all the time, can I give my baby vitamin C? And the answer is, if your baby's vitamin C is being consumed by a disease, your baby needs vitamin C. So why are we so relaxed about giving an antibiotic to a baby? And we're nervous about giving the vitamin C that we know the baby needs. So the baby needs, anyone who has whooping cough, pertussis, needs vitamin C. I don't care what else you want to give. If you want to do homeopathy or conventional medicine, they still need vitamin C. So I have a document that I published maybe 2 or 3 years ago called The Vitamin C Treatment of Whooping Cough that is available for you to read thoroughly and understand the treatment of vitamin C, to use it with your healthcare practitioner, and to understand the few circumstances where you need to be cautious, mostly with dehydration, with some certain enzyme deficiencies, you need to be careful giving vitamin C. The first part of your question was, what do you do if you can only breastfeed for 3 months? If it was me and I could only breastfeed for 3 months, I would first aggressively look into why I'm not producing, and I would do something about that. And I can tell you that, you know, more than half of the time when I do that with women who are breastfeeding, that I can get their production up again. If they can't, then I would find the living wet nurse that I knew, and I would try to get milk for my baby from the wet nurse. And then third choice would be breast milk bank if you live in a country that has breast milk. But I don't believe that there's any substitute, like people say, what about goat and all this? No, because breast milk contains stem cells, it contains retroviral like particles, it contains anti-cancer molecules and also different types of RNA and DNA that are designed for human. If you give your baby raw milk or even pasteurized milk from another animal, you're giving them that animal's genetic programming. So I think human milk for human babies is best, and I try as hard as possible to get mothers to find a good source of human milk for their human baby.
So will my children always have a higher risk for virus or any sickness just because I couldn't breastfeed them?
Yes, I think non-breastfeeding infants are, we know this for certain. I mean, I've got medical literature from the 1940s onward showing the difference in the bowel composition between breastfed babies and milk-fed baby, and I should say animal milk or soy milk-fed babies, and also the immune supporting properties of human milk for human babies is enormous, and scientists that study this as of 2013 are still admitting that there's huge powers of protection in breast milk and that they only understand a small part of it. So even today, scientists are still understanding more about the different components that are in breast milk and how it functions. The oncology, the cancer doctors are now trying to take advantage of a certain chemical in breast milk because it kills cancer cells. So it's very powerful, not only immune supporter, but regulator of microbes. You know, it carries, breast milk, mother's milk takes her bacteria from her intestine and brings it through her body and then puts it into the milk. They used to think that mother's milk was sterile or that it was contaminated when it had bacteria, but then they later determined that it has enormous amounts in just 1 ml, hundreds of thousands of bacteria in there. T cells, B cells, stem cells, and then this molecule that fights cancer, and hundreds of other molecules that they're just beginning to understand. So absolutely, there's a detriment to a baby that cannot get breastfed. But we have to look at, in today's age, the many different ways that babies are immunologically influenced from the time of conception onwards. And it's very different today than it was when I was a newborn, all those things.
The 2 weeks of breastfeeding do some different?
Absolutely. I mean,
nothing at all?
Absolutely. Some breast milk is better than none at all, especially the first drink right away, the colostrum that comes through, and then the first few weeks, it's extremely important because early on is when the bowels are still, the cells in the intestines are still not connected completely, because the design is that to be able to bring in all this micro RNA and genetic material and stem cells, so the bowel is open at that point. And then later on it matures, breast milk helps the bowel mature, and then it closes the gaps later on. So just the same as, you know, early on, babies are more vulnerable to lots of things. That's why they're so much more dependent on milk, and they benefit so much more from it early on. But there's tons of immune globulins in the first few weeks of milk as well. So yeah, it's always, some is better than none, definitely.